It has played a very influential role, not only in the life of the society, but probably more importantly, in the life of people living with Parkinson's disease and physicians and investigators of the PD community at a global level. We all were introduced to a new way of approaching data on how to manage people with Parkinson's disease. At that time, it was very, really innovative in the sense that all the authors, they did a very in-depth review of the available data and providing really a scientific assessment of what works and what does not work, and when it does work, what is the improvement, the benefits, and also the risks. And that led within MDS to the development of a very important program and initiative of doing these evidence-based reviews. They have been repeated for Parkinson's disease, updating new data that is constantly coming up, and it has also spread out to other areas of movement disorders. This is a great contribution of MDS at a global level. In the past, we would really take some of the information in a less critical way, which was not really good in terms of care. So it led to a very scientific way of reviewing the therapeutic options. I must say, this is a strict, perhaps too strict way of approaching treatments, because lack of evidence is not evidence of lack of benefit. So there are some areas where we do not have data, and that when another aspect of the clinical practice becomes important. So less than being a science, medicine can be an art, especially when we have to make choices that are not evidence-based. But of course, the evidence is the departure point of a good clinical practice. So that's really the most important contribution of this paper, really, in my view.